and welcome to Evening. I'm your host, Haidar. Pregnancy continues to carry a high risk of death worldwide, despite numerous commitments to address the issues that fuel maternal mortality. An estimated 350,000 women die each year from complications of pregnancy and childbirth, most from preventable causes. What are the effects and causes of maternal mortality, and what needs to be done in order to improve maternal health is what we'll be discussing today with our guests, Mrs. Farah Younes, a clinical dietitian at Primate Clinics from Beirut. Also joining us via phone is Dr. Simar Alaweyye, who is an OBGYN doctor. Mrs. Sara Haidar, a new mother, will also be sharing her experience via phone from Saudi Arabia. I'd like to welcome our guests, but before we begin, let's take a look at this report.
In 2010, maternal death became a rare event in Bangladesh. The recently released results of the nationally representative Bangladesh Maternal Mortality and Healthcare Survey 2010 tell the story. In 1989, 574 of every 100,000 pregnant women in Bangladesh died during pregnancy and childbirth. Last year, only 194 of every 100,000 died. This is still too many. In the U.S., only 11 of every 100,000 pregnant women die during pregnancy and childbirth each year. Now on track to meet the Millennium Development Goal 5 target in 2015, the decline represents an incredible accomplishment in one of the poorest countries in the world, where gross national income is $580 per person. What happened? More research is required, but initial findings suggest that the reduction in higher risk, high parity births through family planning, and delayed age at marriage explain a quarter of the decline in maternal deaths. Another quarter of the decline is linked to increased awareness of the problem. 68% of women experiencing obstetric complications now seek treatment outside the house, a phenomenon likely mediated by increasing levels of maternal education, household well-being, roads and transport since 2001. The results are also a good reminder that investments in family planning and girls' education drive much of maternal health outcomes. The question that remains is, how can other developing countries with high maternal mortality rates learn from the case study of Bangladesh?
I'd like to welcome our guests once again. Welcome, Mrs. Younes.
Thank you, Sara.
Mrs. Younes, when we're talking about maternal health, what do we mean by the phrase itself, and what does it encompass?
Maternal health, when we talk about it, we are usually talking about the health of women during pregnancy, during childbirth, and during the postpartum period. As the report said, family planning is included in maternal health. Moreover, it should accompany the health of women during preconception, postnatal, and even prenatal care.
So it's not only about when women are pregnant, it's about throughout all the stages that they are going through the process of deciding to have a child. And the report mentioned that Bangladesh had decreased decreased rates of maternal mortality. What are the countries that have some of the highest mortality rates worldwide?
Almost all of maternal mortality or morbidity are in the developing countries, and we are talking about 99% of the rates.
Mm-hmm.
More than a half of the maternal death actually occur in sub-Saharan Africa, and a third take place in South Asia.
Okay.
But what is very sad, not interesting, it's actually sad, is almost a third take place in only 2 countries.
Mm-hmm.
India in 2010, India had more than 30% of maternal mortality, whereas in
So they're focused on 2 countries only, India and
Nigeria. India and Nigeria.
So why is it that we have such high numbers in these 2 countries? Why isn't there an equal distribution of maternal mortality? What are the causes that fuel these high numbers in these countries?
In developing countries at most. In general, women in developing countries have more kids and have more pregnancies than women in developed countries, which increases their chances of maternal death, morbidity, and mortality. Moreover, there is an extreme lack of healthcare, extreme lack of maternal health facilities that will help them. There are unplanned abortions, unsafe abortions, and also many deaths are related to diseases that are commonly present, like
Okay.
malaria and HIV during pregnancy, which will contribute. What's very interesting, Isra, is there is a huge disparity even within the same country.
Okay.
And let's talk about Nigeria or India. There's a big gap between the poor and the rich, so the numbers will be very different among different levels, even within the same country itself.
So the economic level of a family and the economic status of a family will determine whether they're going to have high mortality rates, maternal mortality rates or not, depending on how much money they have?
Yes, exactly. Because the money or the purchasing power will determine their access to adequate healthcare facilities.
Excellent. So they're going to be spending their money on gaining enough healthcare facilities to take care of this pregnant woman throughout her pregnancy and as she moves on. Going back to the idea of developing countries, and again we've seen Bangladesh, one of the things that was mentioned in the report was that they raised awareness about the importance of maternal health. Is it only the issue of not having enough money and not having enough healthcare systems, or is there also responsibility on the mother herself?
Of course, it's a multitude of factors. It's never really one factor that takes place in determining such a big problem or a big issue that we are seeing. I definitely believe that awareness campaigns and educations play a huge part. In one of the research, they actually suggested that every 6 years of education a girl goes through increases her chances of surviving maternal morbidity and mortality, and even her child's health will improve. The survival rates are much better. So education is definitely worth investing in, and awareness campaign will definitely help.
Excellent. And when you talked about educating women and educating young girls, how important is it that the spouse is also well educated? Is it enough from your experience that the woman has all of the knowledge, that the woman is capable of taking care of this child on her own? Or does there need to be this complete system of family planning, of a spouse who understands what are the health needs of the woman in order to reduce the rates of maternal mortality?
To make a real difference, to get statistically significant improvements, I think we should definitely tackle the issue from a community perspective. We are not only talking with the spouse, we're also talking about the family members, like the mother and the father and the whole community. They need to be encouraged to make the right decision. It is not enough to have the women educated, we also need to educate the whole community so they would facilitate this woman's plan of change or plan of improvement to take care of the baby. And as you see, the woman might try to make the best decisions possible, but when the spouse or the mother are not supportive,
it changes everything.
Definitely.
Now, we're going to focus with you a little bit about the diet perspective or the nutritional perspective, since this is your background. We notice that a lot of mothers, as soon as they know that they're pregnant, they start to feed themselves because they need to feed themselves for two. They need to eat all this amount of food because they feel that they need to feed their babies to make sure that they grow appropriately. So from your experience with working with young mothers and mothers-to-be, what have you seen the ways that women deal with themselves when they know that they are pregnant from a nutritional perspective?
Like we said, it differs from one community to another. But there's a huge problem when women become pregnant and they stop listening to their healthcare providers because there are a lot of myths and misconceptions out there. And these travel from culture to culture and from generation to generation, and it's hard to fight against them. One of the main problems I see as a dietitian in my clinic is the overfeeding problem. People still go by the fact that you are eating for two, which is not true at all. In fact, a mother's uncontrolled weight gain will put her at risk of maternal death, mortality, and morbidity because of problems such as uncontrolled high blood pressure, uncontrolled diabetes during pregnancy.
So diet may lead to maternal mortality?
Definitely.
Bad diets, having bad diets.
Having bad diet
Because
problems.
there's also this idea that bad diets or not being nutritioned enough or in the correct manner will lead to sugar diseases or high blood pressure, but it will lead to maternal mortality, is what you're suggesting?
Yes, because uncontrolled blood pressure and uncontrolled diabetes will definitely lead to more complications and maternal mortality and morbidity. So we have two factors here. We have malnutrition that comes regardless of whether the patient or the woman is overweight or obese or underweight. Malnutrition, overweight, usually overweight women at more risk of malnutrition, which will definitely increase the chances of maternal problems and comorbidities.
So if you could rephrase the idea that you mentioned earlier, which is that malnutrition can happen to both overweight and
underweight women.
So does malnutrition mean that they're not getting enough nutrients, or does it have a different meaning?
There's this misconception that malnutrition is related to weight. So whenever we see a thin woman or a woman that is underweight, we assume that she is malnourished. Whereas when we see an overweight or obese woman, we assume that she has good nourishment, which is enough for her preconception and conception and postpartum care. That is actually completely untrue. Malnutrition is the lack of the adequate nutrients. Just because this woman overweight and obese, the probability is, according to statistics, she is eating unnutritious food, which will lead to problems such as iron deficiency anemia, such as lack in certain vitamins and deficiencies, which will be dangerous for her pregnancy and the child. So we need to focus on the nutrition, on the quality of the food, rather than just the weight of the women.
Mrs. Younes, as a clinical dietitian, when you're talking about focusing on the nutrition of the quality of food, how do you see mothers reacting to this idea? Mothers know the harm that they might bring to their children. They've read all the research, they've read all the books, but when we come to reality, they're not applying anything from what they're reading. And from your experience of working with women, why is it that they do that?
It's because the community pressures them to fall into these misconceptions. It's really hard to decide to be healthy and not to gain a lot of weight during pregnancy when, as you said, the spouse or the mother or the in-laws are against that. And hence, awareness should not only target these women, whereas we should actually target the community as a whole to promote the fact that even normal weight women, even women who gain weight moderately, of course, according to the numbers and according to guidelines and regulations, will lead to healthier pregnancies and healthier kids, which is really what we want.
So through educating and awareness, the entire community, we can hopefully achieve that goal. What about the role of the governments in terms of raising this awareness? Is it only the responsibility of dietitians like yourself, or is it the responsibility of NGOs and communities or the hospitals? Who should take responsibility of taking care of this woman who is currently pregnant and is about to have a child?
I think the responsibility should start with the woman itself, because we know better. We are educated, we are strong, we are aware, and we feel the need to be the best we could be for our baby or our future generation. She should seek information. Information comes free these days. She could go online, she could seek any medical care. It should start with the woman itself trying to find answers for her many questions. And then, of course, we want national campaigns. There is a huge need to change the whole idea about how we look at conception or preconception. Even prenatal, even the spouse and the woman should seek medical advice and should seek nutritional advice even before planning conception, because we want to correct many of the deficiencies or the problems before them happening. We want prevention rather than, we don't want to be too late to intervene when these problems come.
What are some of the issues that a family or a couple should look for in order to prevent? So what are the things that they want to prevent? Are they looking for hereditary diseases? Are they looking for a baby who is underweight? So what are some of the medical issues that they want to prevent when they want to go to a doctor and say, I want to have a baby, I'm planning to have a baby, what do I need to do?
Of course. We want to prevent as many of the comorbidities that could happen during pregnancy. We want to make sure that the female or the male have no deficiencies themselves. Iron deficiency anemia is so common, especially in developing countries. It causes a huge percentage of maternal death on a yearly basis. And that's so simple to treat. All we need is a very minimal screening and just some iron pills. So it's very easy to treat. Whereas if we wait till it's too late, then the damage is already done and the baby is already at risk. We need good screening for vitamin deficiency, for nutritional status. As we said, the weight is not enough to judge if this woman has any nutritional problems themselves. Second step we need to look at is the prevention of common problems during pregnancy, such as hypertension during pregnancy and diabetes during pregnancy. Eclampsia and pre-eclampsia are actually quite common and cause a huge number of problems. And they actually cause the birth of infants that are below the weight percentiles that will put them at risks of further development. Moreover, we don't want people to gain weight more than they should. Gaining too much weight during pregnancy puts risk on the women and the child themselves, both during the pregnancy.
What are some of the effects of not taking care of yourself as a pregnant woman, and what effects does it have on your child as well, we'll be discussing after the break.
Around the world, outside the mainstream, anywhere, everywhere. A media of your land, of your creation. A new media in a new era. Will it take the lead in the future? I believe so. This is Underground.
Underground, when vague turns to clarity.
Welcome back. Welcome, Mrs. Younes. Going back to the idea of the factors that affect maternal health, we talked about the importance of nutrition, the importance of having a community, the importance of having a spouse that is also supporting us in terms of raising awareness about taking care of ourselves when we're pregnant. What other factors affect maternal health for women, especially in developing countries?
Basically, one of the most important factors that affect maternal health is the availability of good medical care.
Okay.
We need good facilities and we need clean facilities. More than half of births in developing countries occur without any specialist available. No midwife, no nurse, no doctor.
How do they occur? Naturally?
Naturally. Basically, they occur naturally. So problems like bleeding, problems like infection, problems like sepsis cannot be prevented at all. There is no any special person that is actually trained as a birth attendant is available, which is causing a huge problem. And even if these facilities are available, there is also a problem with the transport to these facilities, because we have remote areas and adequate transportation is not available, which is also causing a problem. As we said, some of these conditions can be easily prevented, and this is why intervention is extremely important. They are cheap to solve and they can be done by minimally trained individuals. So we need to work on the access to medical care.
So there's a delay to access to health facilities. Is there also a delay in carrying time in terms of when a woman goes to a hospital, especially in these remote areas? Is it possible that she has to wait for hours and hours to receive treatment, or will she be treated like any individual in a developed country where she can go in, do her papers, and just have her baby?
Of course not, Isra. We are talking that only half of these women even have not even a doctor, even a nurse available. They don't have them. So even if there is a trained specialist, there are going to be a lot of women that need to be taken care of. So they're going to have to wait in turn, which increases the risk of mortality and morbidity.
Unfortunately. In order to know more about the causes that fuel maternal mortality, is with us over the phone Dr. Simar Alaweyye, who is an OBGYN specialist. Welcome, Dr. Simar.
Thank you.
We're so glad that you're with us and joining us. What are some of the main causes that fuel high mortality rate, maternal mortality rates, and lead to women having such complications while giving birth?
Well, actually, we are in an area that we have a high mortality rate. Usually, these rates are because of hemorrhage during delivery, induced abortion, which usually is aseptic because it's illegal and done in some areas, due to maternal health like obesity, diabetes, hypertension, and the most important cause, which is common in all worlds in the developed countries and non-developed countries, is the hemorrhage. These are mainly the reason why do we have a high mortality rate.
And Dr. Simar Alaweyye, what is the role of a doctor in promoting the idea of taking care of yourself as a pregnant woman? What role does this doctor have? Is it simply to make sure that the weight of the baby and the health of the mother is okay? Or does she also have an educational role that she needs to play with her patients?
Well, in promoting maternal health, we should start with girls. We should start educating girls in schools about, first of all, contraception, which is the basic steps, and then their health. I mean, before getting pregnant, there are some simple rules that should be taught to these girls, that we should have an ideal weight. I don't mean like the models, I mean just not obese. If the patient is, if the mother is complaining of any medical illness like diabetes, it should be controlled. If it is hypertension, it should be controlled. Then we should educate them about some vitamins that should be taken before the conception, before getting pregnant. For example, folic acid, which is very important to decrease the some malformation in the face or in the spinal cord of the baby. Sometimes, if they are not, if they were not immunized to rubella, they should be vaccinated.
So making sure that they have a clear medical background, a clear medical check to make sure that they're on the right track in order to conceive a child.
If I didn't hear you well.
So they need to have a clear medical check for themselves to make sure that they're ready to have a baby.
It's advisable, of course, it's advisable. Unfortunately, we don't have this in all areas. Maybe in the capital, in Beirut, it's easier. But elsewhere, I don't think that we could have this. But of course, it's advisable.
So what role do not only the doctors, but also the healthcare system as a whole have in promoting this idea of maternal health and improving maternal health?
This is the main problem. Actually, we have so many pitfalls in our system. First of all, health system should be, affordable. And you know the situation. Not all the population is able to afford the medical fees, the hospital, the doctors. Second of all, it should be accessible. I mean, you should have facilities with good skilled doctors, with good equipment everywhere. So it should be accessible to every woman. And the specialists, the skilled people, the specialists in maternal health and women health. We should work on this. And finally, the education, which is very, very, very important. As I said, we can start in schools, in media, to educate people about the importance of maternal health.
Dr. Simar Alaweyye, what are some of the negative effects when we have low maternal health, when women are not really taking care of their health while they are pregnant? What are some of the effects on their children?
First of all, if they are not taking good care of themselves, this affects their health themselves. And indirectly, this will have a very bad effect on their kids and on their fetuses. If we're going to take an example, a diabetic mother, a mother with a long history of diabetes, her kid, her fetus, will have some malformation, and a congenital malformation. It means that he will born with some malformation that we are not able to correct this malformation. While if she was really controlled, we could prevent this lethal sometimes malformation. The folic acid, for example, as I said before, the folic acid, which is very, very important to prevent the malformation in the spine or the brain or the face of the baby. And finally, the maternal health in general, everything has indirect effects. For example, the abortion rate will increase in some women that smoke, the preterm labor, the hypertensive diseases during pregnancy, like what we call preeclampsia. I don't know exactly the word, the jargon and not the medical word, which is a serious condition. We can really prevent a lot of these conditions in the fetuses and their mothers.
Dr. Simar Alaweyye, my final question to you as an OBGYN specialist is that we've read a lot of studies that show that women who have HIV are capable of transferring this HIV disease to their children, young infants, through breastfeeding.
Can you repeat the question? I didn't hear you well.
Young women
the mother with HIV,
women
yes?
who give birth to young children and have HIV disease are able to transfer this disease to their children through breastfeeding.
Oh, yeah. Through breastfeeding. Well, by guidelines, your question is about breastfeeding, no?
Yes.
Yeah. In breastfeeding women, we should divide those women in the well-developed area and the non-developed area. In the well-developed area, it is not advisable that the women who are HIV positive to breastfeed their infants. While in the undeveloped countries, we prefer that these women breastfeed their infants, because breastfeeding, though it has a very, very slight risk of transmitting this HIV to their infants, at the same time it can prevent a lot of conditions like gastroenteritis, which is lethal in those countries. But if I'm going to talk about Lebanon, for example, I don't think that breastfeeding will be advisable here.
Dr. Simar Alaweyye, I'd like to thank you so much for your valuable contribution. You joined us from Beirut as an OBGYN specialist. Thank you.
Thank you very much.
You're welcome. Mrs. Younes, when we just had the perspective of Dr. Alaweyye, who's an OBGYN specialist, and she talked about the importance of having affordable health care. How can countries provide this affordable health care if their money is being put in other areas such as education or creating laws or fixing the roads? How can countries say that maternal health is a priority for us and we want to make it affordable?
First, I would like to thank Dr. Simar for all the information she provided. Then to answer your question, we need to make this a priority. We as women need to make this a priority. We need to raise our voice together and say we are a very important member of this community and we are the source of the next generation. So when you take care of the women, when you take care of the pregnant women and then the postpartum women, you are also taking care of the child, you are also taking care of the family, and a better family will definitely lead to a better community. So it is much more important to invest in that than to invest in other areas that have many future consequences later on. We need to begin with the basis, which is the maternal health and hence the health of the whole family. And then we need to look at other areas. So we need to put our voice together on this issue.
A big question that is asked is that pregnant women don't have the time. They're too busy either being shopping for their new baby, finalizing everything, or they're too tired, and they just don't have the time to speak up. They don't have the time to worry about other pregnant women or to worry about the idea that we need to work together to raise awareness. So if pregnant women are too busy doing that, what is supposed to be done? Are other kinds of women supposed to support pregnant women and say, let's all raise our voices together? Or should pregnant women make this a priority for themselves as well?
As you said, Isra, especially pregnant women who already have children. This is not the first or the second pregnancy. They already have kids to take care of. They need to send them off to school. They need to take the responsibility of the whole family. Of course, we understand that the lack of time is unavailable. But that's why we need to support each other as women. We don't have to wait till we're pregnant or even married to voice this issue. This is not just about married women, this is about the health of women in general. I might not be a wife, I might not be a mother, but I am an active member of this community, and I do have my whole family to help me and support and to take care of. This is not just an issue that pertains to motherhood. This is an issue that takes care of kids as well, of children, and hence school teachers need to support it, female workers need to support it,
female politicians as well.
Female politicians, housewives, we all need to take a stand and to put this a priority, because it will make our life easier when we have better access to healthcare and we have less problems to deal with. It will lead to better time. For example, a pregnant woman who already has 2 kids to support and to take care of cannot afford to have diabetes during pregnancy, cannot afford the medication needed, cannot afford to have eclampsia or preeclampsia, which are very serious conditions related to uncontrolled blood pressure during pregnancy. She cannot afford to take care of these medical problems when they develop, or even cannot afford to take care of a sick kid that might be the result of...
And might be a burden on herself financially and time-wise.
Of course. So we are actually investing in more time and energy and health for our family. And that's when we talked about earlier, it's about prevention rather than treatment after the problem has occurred.
I love how you put out the issue in such a way of prevention, and I love how you made it such a female issue, a community issue. But when we truly look at developing countries, and to be realistic, it is very difficult, I don't know if you agree, it is very difficult to raise awareness in a certain way that can reach these rural communities and these people who are in villages and who are very far away. So how can countries succeed in raising awareness and changing the mentality if you have low education, if you have poverty, if you don't have access to roads? What needs to be done?
Isra, we once had a talk, and you said sometimes change needs to start with one person. And I definitely agree in this situation. We don't have to have multinational campaigns and awareness campaigns to start having real change. It only takes one person. One person in a community, in a small village, can actually make a change in the whole village itself if they just voiced out their opinions.
Or if she simply went to the doctor and came back, she could share maybe the knowledge.
She could share the knowledge. If one person in that village had access to good medical care or to good medical advice, if that person or that woman just shared the information available within her immediate community, within I'm talking about 5 other women. And these women actually shared the information of this health. The message will go on. There are very cheap and easy ways to display health. And I think that would be the smartest thing to target in these women. Maybe little workshops in local mosques or local churches or local community centers that might take 1 hour with a skilled health professional, can send messages to thousands of women through generations, because these women will support their sisters, they support their friends, they support their neighbors with this kind of information that can actually spread from one generation to another.
So this is how communities can mobilize the women around them and share information even in the simplest ways. After the break, we're going to take the perspective of a new mother who's going to share her experience with us from Saudi Arabia. Please stay tuned.
Pollution and climate change, medicine manipulation, genetically modified food, the destruction of wildlife, and corporate exploitation. These are all part of a new terrorism threatening our future.
Eco-terrorism, global awakening to a world under threat.
Welcome back. Maternal health is what we're talking about today, and with us here in the studio is Mrs. Farah Younes, who is a clinical dietitian at Primate Clinics Beirut. Welcome again, Mrs. Younes.
Thank you, sir.
When we're talking about educating women in order to support other women who are pregnant, we need to have healthcare professionals, but not everyone has access to medical school or to become a doctor. So what other alternatives are there for training young women in order to support pregnant women throughout their delivery process?
Anyone can train. They don't have to be medical professionals or go through the extensive years of medical school or training. A professional nurse can definitely do the job, and traditional workers can be trained to become very skillful midwives. That is also a point we can definitely rely on when we need more medical professionals.
So how do you define a midwife? Because this term might have some different meanings according to different countries and according to different cultures. What is the accurate definition of a midwife?
I'm not familiar with the exact definition, but I can tell you that actually a midwife, usually there's a university degree.
Okay.
She actually specializes, she's a nurse that specializes in midwife care, and she has official papers and she has official training.
So she needs to have an official degree in order to become a midwife, unlike other countries where it is just something that happens by practice.
No, she is definitely, or he or she is definitely a part of the medical team, and they are a trained professional to do the job.
In order to take care of women.
And they are even trained to take care of emergencies in case the doctor is not available.
With us over the phone right now is Mrs. Sara Haidar Al-Akhdar, who is a recent mother who is joining us from Saudi Arabia. Welcome, Mrs. Haidar.
Thank you.
Mrs. Haidar, as a new mother, first of all, we'd like to congratulate you. And we'd like to ask you about your experience of the maternal health process that you went through. Did you feel that you were taken care of by a hospital, or did you feel that you were taken care of by the doctor that was treating you throughout your pregnancy?
Well, as a new mother and during my pregnancy, with pregnancy comes a lot of new feelings, and it's a whole new experience, whether it's excitement, anxiety, happiness, and I had to pay attention to both psychological and my physiological well-being. I found a lot of answers that I had questions for with my doctor, who I attended and I was seeing for the 9 months of my pregnancy. Now, in my hospital that I was going for my regular checkups, I was provided by different awareness centers where they had lactation consultants, they had motherhood and baby courses. But as a new mother, mother-to-be, I was overwhelmed by this whole new experience and where to go for information. So I found myself running to the internet sometimes and having this rush of information that made me sometimes even more and more confused. So my main resource for information for me to be able to settle down and be at ease with myself was my doctor, my healthcare professional. That's where I found the answers that I needed, and that satisfied my curiosity and my need to know more and to feel safe and secure and to feel that my baby is safe.
And Mrs. Haidar, were you able to access your doctor easily? Did you feel that whenever you had a problem, you were able to pick up the phone and simply call her? Or did you have to wait for maybe days or weeks in order to contact her?
Well, personally, I had the privilege of having my doctor's personal number. Not all hospitals share this policy where they give the patient this privilege. I was fortunate enough to have a 24/7 hour access for my doctor, where any concern that I had, I could just contact her immediately. At certain times, she would have an emergency or she'd be out of the hospital. We were referred to a special call center where we would have professionals also, not necessarily my personal doctor, answer our questions and to inform us on certain situations, what we should do. Because usually during pregnancy, the mother, her concerns are overrated sometimes. So it's really important to call back and check with professional healthcare providers for us to understand whether it's necessary for us to come into the hospital or it's just a matter of overreacting, and we just need to calm down.
Mrs. Haidar, please stay with us. Mrs. Younes, what are some of your comments regarding what Mrs. Haidar just gave us about her experience as a new mother?
I was actually intrigued by the fact where she talked about the overflow of information, especially on the internet or from neighbors or for friends or from others. We definitely need to differentiate the good information from the discredited information. And here is where the health specialists come in. So I definitely recommend all new mothers or women or mother-to-be's in general to ask their doctor about the right places where to seek information from. Direct access to your OBGYN or doctor is definitely not needed in most cases. Except in severe emergencies, it is recommended to just directly go to the emergency room because mothers tend to over-worry, especially if it's their first experience. And hence, we need other sources so we can rely on. So I definitely recommend to talk to the healthcare professional and be referred to certain sources. There are also trained nurses that are usually available in the OBGYN clinics that are available all day long to take in questions of over-worried mothers, where the doctor can actually call back and calm her down and be sure to take care of all the emergencies.
When tackling the issue of maternal health, we focus a lot on the underdeveloped countries, and we tend to overlook the developed countries, such as the United States and Canada, and we just assume that everything there is perfect, everything there goes well, but do developed countries also face issues regarding maternal health, not in terms of access to healthcare professionals, or do they have any other issues that they should focus on or that they lack in these countries?
Definitely, with more developed countries, we will see more overweight, sometimes more overweight or obese mothers as compared to underweight or malnourished mothers. And here we have to refer back to what we talked about, malnutrition. So malnutrition is just as common in these cases because these women tend to overeat unhealthy food rather than healthy food. And here is, we have inappropriate weight gain issues and problems that we need to take care of. Or sometimes even the lack of time because of busy schedules and busy or too much to do for access to this good facilities and to these good information.
Mrs. Haidar, what are some of your recommendations regarding other women or other friends that you've worked with or you talk to when taking care of themselves while they're pregnant?
Well, there's one important point that most moms-to-be disregard. It's having your partner take part in this whole process of taking care of yourself, taking care of your baby, the whole path of pregnancy, the 9 months of pregnancy and post-pregnancy. It's really important. 3 things which I see personally work very well for me is, number 1, to have your partner on your side throughout the whole journey, whether it's searching up new information, exploring the physiological changes that occur in your body. And it's really relieving if you have a shoulder to lie on and if you have someone there to support you. Sometimes you know the information and you know what to expect, but you're overwhelmed. So you need a partner next to you to maybe soothe you and make you go back to your feet and understand that this is a natural process. This is what's expected to happen. And number 2 is you need to know where you get your information from. As your guest mentioned, a reliable source. And number 3 is the golden rule, which my doctor told me, is there is no such thing as a silly question. You have to never underestimate any concern or question that comes up on your mind, especially moms to be that are experiencing pregnancy for the first time. You might be shy, or you might feel like this is a silly question. What's the doctor going to think? What is she going to say about me? These are things that you should leave to the back of your head and just go for it. Because there's, as I said, the golden rule, no silly question. And once you get these problems out of the way, you'll be more able to enjoy this miracle in making and experiencing this life that's growing into you. So it changes the whole perspective of the way you observe life and you see life, because it's actually growing inside of you.
And did you feel, Mrs. Haidar, that while you were being taken care of by your doctor, your physician in the hospital, that you were more relaxed as a mother, that you felt you were capable of giving all this love and all this energy to your child, and hence you felt that you came back as a strong mother, a mother who was able to change the way that her child is going to be raised for a better purpose?
Yes, exactly. I felt that with all this, I had a very supporting environment, whether it was from my partner, my family, whether it was from the physicians and the hospital that I attended. All of these different factors empowered me as to being a stronger mother, mentally, emotionally, and by which this immediately affected the well-being of my own baby, as there's a strong relationship, emotional, psychological, and physiological relationship between the mother and child. So I feel that I was privileged, very privileged, to have all of this nourishing environment around me. And this certainly, as you said, empowered me and gave me the opportunity to be a strong mother and to reflect in this matter, this strength onwards to my baby. So yes, as you mentioned.
Mrs. Sara Haidar Al-Akhdar, we'd like to thank you so much for your valuable contribution, and we'd like to wish you all the best with your new family. Thank you for your information.
Thank you very much. Thank you.
Mrs. Younes, do you have any comments on what our new mother just provided us with in terms of taking care of children and having this supporting environment?
I want to thank Sara for a very specific advice where she said there is no silly question, and that is extremely true when it comes to anything that is concerning health or medicine or health risks. And as a new mother, any mother should feel supported enough to ask any question and to take all the time she needs to gather all the information she needs to feel safe.
Sometimes mothers survive the pregnancy and they face a lot of difficulties, and they live with scars, they live with damaging effects, they live with medical conditions that might affect their ability to love their child in the same way if they were normal and natural and everything was okay. So what are some of these effects that might sustain with women who went through difficult pregnancies, and what effect does it have on the psychological and the emotional well-being of a mother?
We would definitely worry about the psychological effects more than the medical effects after post-birth or postpartum, because we assume that the woman did take care of the medical conditions to her best available medical care possible. But we worry about the psychological scars that tend to stay much longer than the medical scars.
Okay.
And in this case, we definitely advise all these women, if professional help is not available, to seek the help within the community, within the supportive environment around them, within the spouse, the partner, the sister, the brother, the co-worker, anyone who is available to help them through this difficult period and to help them retouch the essence that actually caused the problem in the first place.
We define,
and reconnect with the child.
Definitely. We define maternal health at the beginning of the episode as not only the process before or during, it is also the process after. And this is what I'd like to focus on in the remaining time of our episode. How important is it that women take care of themselves after they've had a baby? Is it enough just to take care of themselves medical-wise as they are pregnant, or is it also important to take care of themselves after they have had their child?
The problem is they tend to not take care of themselves at all. After giving birth, the main focus becomes the baby, especially for new mothers. Women tend to take care of themselves at all. They tend to lack of sleep becomes the problem. Depression, baby blues, postpartum depression is a big issue that is never really talked about because it's still
a taboo subject, maybe.
It's still definitely a taboo subject, especially in developing countries where it is where women fear or are ashamed of talking about these problems that they are facing. We have lack of sleep, we have medical conditions that they are not taking care of. They stop their OBGYN follow-ups. They tend to focus more on the baby follow-ups
and the
pediatric follow-ups. So maybe our main recommendation in this case, our main hope is for these women to actually take care of themselves first. They are the pillar of the family, and if the mother is not taken care of, then she cannot take care of the child.
And with that, I'd like to conclude with you, Mrs. Farah Younes, a clinical dietitian at Primate Clinics from Beirut. I'd like to thank you so much for all the wonderful and valuable information that you gave us today. I'd also like to thank all of our guests, Dr. Simar Alaweyye, who joined us via phone, and Mrs. Sara Haidar, who also joined us via phone from Saudi Arabia. And I'd like to thank you, our viewers, for tuning in, and I hope to see you next week. Take care.